Hana. I'm going to be your nurse today. Before walking in the room, I would knock and I'd perform hand hygiene. Could you tell me your name and date of birth?
Emily Lincoln, 8/10/95.
Great. Can I compare that with your wristband? Looks good. Do you have any known allergies?
No.
Okay. So today I'm going to be performing a head-to-toe assessment. Is that okay with you?
Yes.
Okay. Do you know where we're at?
My house,
Okay. Do you know today's date?
December 4th, 2020.
Okay. So from that, I can tell that my patient is alert and oriented. Could you tell me your height and weight?
5'3", 120.
So from that, I can tell that her body stature is appropriate with her height and weight. I'm going to start by assessing her vital signs. I would assess her radial pulse for 30 seconds and take her respirations at the same time without her knowing. Her pulse was 68 and her respirations were 18. And I don't have the tools to do so, but I would assess her temperature, O2 saturation, and her blood pressure to ensure they're within normal ranges. Judging by my patient's appearance, her colors are even and appropriate for her ethnicity. Her facial features appear symmetric and she doesn't show any signs of distress. Her body posture is upright, it is symmetrical, and shows no signs of deformities. So I'm going to go straight into the head-to-toe assessment. I'm going to start with palpation of the head, and I'm going to work down. So I'm going to start by palpating the head. Hair is evenly distributed. The head of the client is rounded, normal cephalic, and it is symmetrical. Moving on to your eyes, do you wear glasses or contacts?
No.
Okay, great. Looking at my patient, I can tell that her pupils are even and they're round. I'm going to shine my pen light in your eyes to check for reaction to light and make sure they both dilate. Okay, ready? Good. Both pupils accommodate bilaterally. So next I'm just going to pull down on your eyelid. The conjunctiva is pink and the sclera is white. So that is good. The hair of her eyelashes and eyebrows are evenly distributed. Could you raise your eyebrows for me? Great. Her eyebrows are symmetrically aligned and they both show equal movement. I'm going to move on to assessing your ears. Do you wear hearing aids? Do you have a history of chronic ear infections or pain in your ears? Okay, I'm going to palpate the ears. Okay, they both appear firm, not tender to the touch. There is no redness. Was there any pain with the palpation? Okay, great. So I'm going to move on to assessing her nose. Could I have you lift your head? I'm just going to look in the nose. Okay, looks good. Do you have a history of runny noses or nosebleeds?
No.
No? Okay. There's no redness or drainage or signs of deviated septums to the nose. Have you ever had any trauma or no surgeries done?
No.
Okay. So I'm going to have you plug one nostril like this and breathe. And the other side. Okay. Her nares are patent bilaterally, so she has a good airway. I'm going to move on to assessing your mouth. I'm just going to have you open your mouth and shine the light in. Okay. Say ah.
Ah.
Great. Her mucous membranes are pink and they're moist and her teeth are intact. There's no discoloration of the enamels and no retraction of the gums. Her uvula rises and falls with the midline and her lips are pink and do not appear dry. Moving on to your cervical spine, I'm going to have you look up and then down and to either side. Okay, great. Patient does have full range of motion of her cervical spine, so next I'm going to assess the carotid arteries and pulses bilaterally. So I'm just going to have you turn this way. Feel your carotid artery. Okay, great. And the other side. Great. She does have +2 bilateral pulses. So I'm going to move on to the chest, where I'll be assessing lung and heart sounds. Do you experience any difficulty breathing at rest?
No.
Okay, and what about with activity?
No.
Okay, could you cough for me? Okay. So judging off my patient right now, she does not appear to have any labored breathing, and she's not using any accessory muscles. I will be putting my stethoscope on in your chest. Each time, just take a deep breath.
Okay.
Okay, great. I'm going to do the same on the back. Could you just turn? Thank you. Okay, so her lung sounds are clear bilaterally on her anterior and posterior chest. No adventitious sounds were noted. So next I'm going to go ahead and listen to her heart sounds. You can just breathe normally for this. I'm going to use the bell of my stethoscope and listen for murmurs. So heart sounds were normal, with no extra heart sounds noted. There was no murmurs upon auscultation. So next I'm going to assess your skin. Could you pull up your sleeves? Great. So her skin appears warm with pink undertones and is warm to the touch. There's no tinting present. There's no lumps or lesions and no tattoos, anything like that. The skin appears to be well moisturized. I'm going to assess your capillary refill. So just going to pinch the skin and assess the time it takes to go back to normal color. And it is under 3 seconds, so that is normal. Her nails are short and round and clean in appearance. They don't appear to show any signs of clubbing. So next I'm going to assess your apical pulse, so if you just want to go ahead and lay down. And I'll be assessing this for 1 full minute. I'm just going to have you lift up your chest for me. So you can stay laying down. Her apical pulse was 70 and regular. And I took that in between the 5th intercostal space. Next I'm going to be assessing your abdomen. So for this, I would typically bring up the patient's shirt and assess it against the skin, but in this scenario I'm just going to leave her shirt down. Looking at my patient, I can tell that her contour is flat, her umbilicus is midline, and her skin is consistent without any lumps, lesions, or pulsations, and there are no hernias present. Is that correct?
Mm-hmm.
Next, I'm going to auscultate all 4 quadrants of the abdomen for bowel sounds. But before I do so, are you experiencing any pain in any of the quadrants?
No.
Okay, great. I'm just going to use my stethoscope and auscultate. The patient does have normal bowel sounds in all 4 quadrants. And you don't experience any pain in any of the quadrants, right?
No.
Okay, so moving on to the urinary system, do you experience any pain with urination or difficulty voiding?
No.
Okay, great. I'm just going to go ahead and touch a couple of spots on your stomach. Let me know if there's any pain. Any pain?
No.
I would check for distension of the bladder also while doing that. Patient reports no pain or tenderness upon palpation, and she was not grimacing or anything like that. While you're laying here, I'm going to check your pedial pulse. Pedial pulse is +2 bilaterally, and I also assess the posterior tibial pulse, which is also +2 bilaterally. I'm going to have you bring up your knees, and I'm going to I would check for any edema, and I would feel the gluteal pulse. Okay, +2 bilaterally for the popliteal pulse. No edema present bilaterally on lower extremities. You can go ahead and sit up. And I'm just going to have you push your arms against mine outward and towards yourself and to the sides and up. Okay, great. And I'm going to do the same with your legs. We're just going to do this. Okay, out. Okay, great. So 5 out of 5 muscle strength on upper and lower extremities. And that concludes our head to toe assessment for today. Do you have any questions?
No.
Okay, thank you.